Hi, this is Nikki. This is my case remediation project for the HIT 213 course. I chose 10 cases from previously completed MindTap assignments. I will try to just highlight through each one of the cases what I found to be beneficial to code. So I will try to stay within the time frame. I also Googled each one of these cases to just be a little bit more familiar. Starting with case 1, I would Google dislocation of right wrist. Patient presents with right wrist pain due to fall from skateboard. X-ray of right arm and wrist reveals a dislocation of the right wrist. A closed reduction of the distal radial ulnar joint was performed. Patient was fitted for splint and shoulder immobilizer. So, in coding this, I would start with reduction. So it's telling me to see the reposition. So we're going to start with reposition now. We know it's of the joint. And we know it was a wrist joint. And we know that it was the right wrist. So our approach we know is going to be external because it was the splint and immobilizer. And we know that there is no device. So that gives us our code of 0RSNXZZ. Okay, case 2. Patient presents for removal of an impacted molar, lower left side, due to pain and slight movement of existing teeth. Surgical intervention is needed. The soft tissue was dissected to expose the impacted tooth, and the tooth was removed in whole. So we know that the in whole is important. I would Google removal of impacted tooth or molar. In coding this, I would start with the resection. Since it was removed in whole, we know it was the tooth. And we know that it was a lower tooth. So it pretty much looks like it's self-populated. We need to pick a qualifier. I am going to choose 0 since it was a single molar. So that gives us our code of 0CTX0Z0. Case number 3. So for case 3, patient was taken to the OR, an upper midline incision was made and retractors were placed. The LUQ was explored and the splenic ligaments and the gastric veins were identified and divided. Dissection at the splenic hilum occurred and the splenic vessels were identified. The splenic artery and vein were double ligated, suture ligated, and divided. The entire spleen was removed and homeostasis was achieved. So again, we know that the entire spleen was moved and that there was an incision place. Splenectomy would be what I would Google, removal of the spleen. So we can start with splenectomy, which tells us that we are going to see something else. So we are going to choose the resection because the in whole. And if we look over here, we know that it was of the spleen. So we're going to choose the P, and we know that it was open because there was an incision. So that gives us our code of 07TP0ZZ. Case number 4. So case number 4 was a preoperative diagnosis with a left breast mass. Patient presents with left breast mass. Incision was made in the upper portion of the breast. Cautery dissection was used to elevate the skin flaps, homeostasis was achieved, and the dissection was carried down to remove the tissue, and biopsy was taken. The specimen was sent to pathology. So you could Google excision of breast tissue or breast tissue biopsy. So encoding this one, I would choose an excision. So we know that it was an excision of the breast, and we know that it was our left breast. So that pretty much takes care of the majority of the code. We know that it was open because it said the dissection. So we select the 0, and then we are going to select Z for no qualifier to give us our code of 0HBU0ZZ. Okay, case number 5. So for case number 5, I would have Googled orbital lesion of the eye or eye lesion. Patient presents with orbital lesion, OS left eye. The upper lid was averted and a herniated lesion was located and measured. The lesion was clamped and excised. The mass was sent to pathology. So encoding this one, I would choose the excision because it says that it was excised, so excision, and we know it was of the orbit, and we know it was of the left eye, so we'll select that. We are going to select open, and then we are going to select Z because it was not only diagnostic, but it was also therapeutic. So this gives us our code of 0NBQ0ZZ. Case 6. So for case 6, patient presented 37 weeks pregnant with elevated blood pressure, suspected suffering from preeclampsia. Examination revealed interuterine growth retardation or fetal small growth and vomiting blood. Contractions were occurring but not regular. Patient was 3 centimeters dilated. Due to problems presented, emergency C-section was advised. A low transverse incision was made and carried to the level of the fascia. Patient tolerated procedure well, and mother and baby were fine. So encoding this, we are going to, I would Google emergency C-section or cesarean, low transverse. So we are going to start with, since we know that they're giving a C-section, extraction, and we know that it's a product of conception since she's pregnant, and then we know that it was the low transverse. So that gives us our code of 10D00Z1. Okay. Case number 7. Case 7, patient presents 7 centimeters dilated with contractions. Mother is an admitted cocaine addict. Blood sample of the fetus is going to be obtained. The amniotic sac is broken and the amnioscope is inserted through the vagina. An incision is made in the scalp and the blood sample is aspirated into a tube and sent to the lab. The baby was not delivered. So I would look amniocentesis, fetal blood sample via amniocentesis or amniofluid, amnioscope. So for this one, we are going to code drainage. And then again, we know it's a product of conception. And we know we're going for a fetal blood. There it is. So we'll click on that. So then we get the, I'm going to select this one because it says the scope, and then we know we are looking for fetal blood. So there is our code of 10908Z9. Okay, case number 8. So for case 8, case 8, we are going to Google hydrocele or hydrocelectomy or hydrocele excision. So under general anesthesia, a 3.5 centimeter incision was made in the left scrotum and the hydrocele was visualized. Hemostasis was achieved. The hydrocele was located in the tunic vaginalis and was dissected and brought through the incision site. The hydrocele was surgically excised and a drain was placed. So for this one, we could try hydrocelectomy. Okay, so it tells us to see excision male. So excision male. Okay. Excision male. So I guess we'll do it this way. So we know that, let's see, right here, the tunica vaginalis, and on the left, we know that that's going to be open and that there is no qualifier. So that gives us our code of 0VB70ZZ. Okay, case number 9 is a pretty straightforward one. I'd say it was easy, but I don't think any of these tend to be easy, at least not at this point. This is a 78-year-old patient presents with a nosebleed for that lasts 4 hours. The patient states that it has increased over the last hour. He has a platelet disorder. He was packed in the nasal area to stop the bleeding. So you could Google nasal packing for this, and we'll try packing, nasal, and that one's extremely straightforward. So it is 2Y41X5Z for our code. I don't think I'm going to make it, so I'm going to stop this, and I guess I'll start a new one for the last case.